Some of the most basic things to know about hair loss in general, whether you're losing hair for the first time or whether you're not, and it's something that you should be aware of. It's really important because a lot of people don't know some of the basics because it's not something that doctors talk about. First of all, there is no cure for hair loss, unfortunately. In other words, once a follicle that produces hair, once that follicle dies, it's game over. There's nothing in this world that can revive it and bring it back to life, unfortunately. So in essence, there's no cure. The closest thing there is to that is hair transplantation, which is surgery. And that's when follicles are removed, generally from the back of the head, and retransplanted onto the top of the head. Also, if you're losing hair for the first time, there's really no need to panic. You need to just understand some of the basics. You need to understand that it could be a temporary thing. A lot of times hair loss, particularly with women, tends to be temporary. Anything could affect hair loss. Even something as simple as stress can cause for you to lose more hair than normal. Chemical imbalances, hormone imbalances, illnesses, changes in diet, changes in medication, any of that can cause it. So what I would do is I would keep an eye on it for about a couple of months, 2 to 4 months, and see what happens. And if it continues to accelerate in terms of the hair loss, then I would call someone like myself and get some more information, or I would just talk to your doctor and just get some basic information. Some of the things you may be able to do, there's some over-the-counter stuff that you can do, such as you can buy minoxidil-based product like Rogaine, for example, and that's a topical application where you apply it to the top of your head. That generally works to stem the loss at a minimum, and a lot of times it helps to grow new hair as long as the follicles are still alive. And that's the key. If the follicles are alive, then there's treatments that can work, such as what I discussed, or using a laser comb. Laser therapy really works. Both of those work in a way where they stimulate blood flow to the follicles, and the more blood flow forces the follicles to continue living and to continue producing hair. Another thing for men that you could consider if you're just starting to lose your hair, it's not over the counter, but it's doctor prescribed. You can go to your doctor and ask for finasteride. The most well-known brand is Propecia for that, but the drug itself is finasteride, and that's a pill that you take orally. It has some side effects, so you want to keep an eye on it for a couple of months and see if you have any serious side effects. But finasteride tends to work as well. So those are generally the 3 FDA-approved drugs that work, whether it's minoxidil, which is a topical form, whether it's finasteride, which is a pill form, or laser therapy. Beyond that, if you're at a point where you've had significant hair loss, then the best option usually is hair replacement, which is a non-cosmetic, non-surgical application. It's quick, it's seamless, and it's a way where we utilize 100% human hair. We integrate that with your own existing hair in a very natural way, in a very age-appropriate way, where we match the density level to your hair, the wave pattern, the curl, the color, of course, the amount of gray, if any. So all of those little details are taken into account to create a system that blends in a natural way with your existing hair.